So I think in the absence of it is just means a sector-wide approach. It's
The Ministry of Health that can liaise with the National Assembly.
HIV. You know, there was a form of carry.
Some details of some new disease that find some of these influencers.
This is the ultimate, Mr. Chairman. You gave our Honorable Minister and your team, Honorable Dr. Jeremiah.
the last money that we had grant for vaccine financing was 2024. Even that was not complete. Yet we have continued to immunize Nigerian children to protect them from diseases. We have outbreaks that we protect Nigerians. We did a massive measles and rubella campaign, but the counterpart funding that Nigeria should put is always late in coming. How do you explain that? Now, naturally, these actors will use other technical partners, but we have to accept. But if we want to exit dependency, the best way to be dependent, to use your sovereignty, is to use your money and release your money, and then you have full control. But you can't want to control somebody else's money and without putting your own money on the table. So, Right Honorable, that's the position.
Some of those things we are still going to look at the budget, and if there's any need where we need to call the ministry, we'll still call the ministry before we sign it. One thing I wanted to understand is that for some of us that are even in the health sector, Abuja declaration was done in this country here. And then up to today, many countries have gone to move their budget up to over 15%. But for many years, the budget of health is still less than 10%. And our population is growing in millions. And we are dealing with a budget that is not growing in proportion with the population. So we need to understand that in budget. And many of the things, I'm quite aware, if the intervention we did in health institutions, if the budget of 2025 was fully funded, there was no request for, when we had an interaction with the head of agency, that means the teaching hospital and so, anybody that asks for house quarters, we approve it for them. Because we knew that that was the only way to expand the carrying capacity of many of the teaching hospitals.